Prostate biopsy. It's the gold standard test for confirming prostate cancer. But what really is a biopsy, and why do doctors sometimes say wait and watch instead of doing it straight away? Let's uncover when, why, and how this test is used. When is a prostate biopsy needed? According to NCCN guidelines, the PSA blood test is elevated, usually above 4 nanograms per milliliter or rising steadily, or the digital rectal exam DRE feels suspicious, or an MRI scan shows a suspicious lesion, PIRADS 4 or 5. But sometimes it's delayed or avoided in men with low risk features, other health issues, or very slow growing findings. There isn't just one way to do a biopsy. The main types are transrectal ultrasound, TRUS guided biopsy, the most common, with sample needles passed through the anal passage using ultrasound. Transperineal biopsy. Needles go through the skin behind the scrotum. Usually, we take 10 to 12 samples, sometimes more, if MRI has shown a specific suspicious area, called a targeted biopsy. It's less likely to cause infections. MRI guided or fusion biopsy combines scans for ultra-precise targeting of problem areas. How can you prepare before procedure? Tell your doctor about all medicines, especially blood thinners. You might need to stop some medicines a few days ahead. The procedure is done under local anesthesia, so don't worry to be panic of a biopsy. Before you have the TRUS, your doctor shows you the ultrasound machine. They also show you the very fine needle they use to take the tissue samples if you are having a TRUS guided biopsy. It can make quite a loud noise, so it's good to expect this. During the biopsy, you lie down on the scan table. They usually ask you to lie on your left side with your knees pulled up towards your chest. Your specialist injects local anesthetic into your back passage, rectum, to numb the area. The doctor puts an ultrasound probe into your rectum to examine your prostate. To get the samples of prostate tissue, they push the fine needle along the ultrasound probe and into the prostate gland. Your doctor uses the information from your MRI scan to guide where to take the biopsies from. Doctors call these targeted biopsies. They usually also take samples from other areas of the prostate. These are systematic biopsies. If your MRI did not show any specific area that looks suspicious, then you only have systematic biopsies taken. Your doctor will tell you how many biopsies they plan to take. The whole procedure takes about 20 to 30 minutes. After the test, you have a rest and a drink. The team monitors you for at least 30 minutes afterwards. You can then go home. It's important to drink a lot of fluids for the next 24 hours. Possible risks. TRUS and guided biopsies are safe tests, but there are some possible risks. These might include blood in your urine, poo, semen, infection, pain, and not getting enough biopsy samples. You usually have blood in your urine for several days afterwards. Drinking plenty of fluids helps to flush out the blood and helps to stop you from getting an infection. Speak to a doctor or specialist nurse if you have signs of infection. This includes a high temperature, difficulty passing urine, and a need to pass urine very often, a lot of blood in your urine or poo, and shivering or shaking. You won't get any results at the time of the scan. Any prostate tissue samples taken are sent to the laboratory to be looked at under the microscope. You should get your results within 1 or 3 weeks. Waiting for test results can make you anxious. Ask your doctor or nurse how long it will take to get them. Contact them if you haven't heard anything after a couple of weeks. Remember, not every abnormal test means you need a biopsy right away. Doctors consider your age, health, PSA trend, and MRI scan results to choose the safest, most sensible plan for you. So, what comes after a biopsy? If cancer is found, what treatments are possible? And how do doctors help you choose what's best? The biopsy gives us the most crucial information, the Gleason score, which tells us how aggressive the cancer is. In the next episode, I'll explain how we use biopsy results and scans to stage prostate cancer and how staging guides the right treatment options for each man. Thank you for watching.